In atrial fibrillation, ablation procedures, clinicians must create durable lesions around the pulmonary veins while protecting adjacent structures. When conventional thermal tools produce inconsistent lesion depth or unintended thermal spread, the risk of collateral injury and incomplete electrical isolation increases. Atrial fibrillation affects millions of patients worldwide and is a major contributor to stroke, heart failure, and reduced cardiac efficiency. Catheter ablation aims to electrically isolate the pulmonary veins to restore rhythm control. However, inconsistent lesion formation or damage to surrounding anatomy can reduce procedural success, prolong procedure time, and increase the likelihood of repeat interventions. These limitations arise because traditional radiofrequency and cryoablation rely on thermal energy transfer. Heat or freezing must diffuse through tissue to create lesions, often producing variable lesion geometry and unintended injury to nearby structures such as the esophagus or phrenic nerve. This thermal dependence can result in incomplete ablation lines, tissue edema, and procedural variability. The Boston Scientific FARAPULSE pulsed field ablation system is a catheter-based platform designed for pulmonary vein isolation using non-thermal energy delivery. The system includes the FARAWAVE multi-electrode ablation catheter, the FARADRIVE steerable sheath, and the FARASTAR pulse generator. Together, these components support controlled delivery of pulsed electric fields for rapid and reproducible atrial tissue ablation. The system operates through pulsed field ablation, delivering microsecond-scale, high-voltage electrical pulses that induce irreversible electroporation in myocardial cells. These electric fields create nanoscale membrane pores, disrupting cellular homeostasis and leading to controlled myocardial cell death. Because this mechanism is non-thermal and tissue-selective, it preferentially affects cardiomyocytes while reducing injury to surrounding non-cardiac structures. The FARAWAVE catheter features an expandable multi-electrode design that can conform to varying pulmonary vein anatomies. The system integrates with standard transseptal access and electrophysiology mapping workflows. Safety controls include predefined pulse parameters, catheter positioning feedback, and single-use sterile components designed to support consistent energy delivery and procedural control. A typical workflow includes femoral venous access and transseptal puncture, advancement of the FARAWAVE catheter into the left atrium, positioning at each pulmonary vein ostium, and delivery of pulsed field energy to achieve circumferential isolation. Electrical isolation is then confirmed using standard mapping techniques. Clinicians should follow the instructions for use for detailed parameters and procedural guidance. In multicenter clinical evaluations of pulsed field ablation for atrial fibrillation, the FARAPULSE system demonstrated high rates of acute pulmonary vein isolation with favorable safety outcomes. Studies reported durable lesion formation and low incidence of thermal-type collateral injury, supporting pulsed field ablation as an alternative to conventional thermal ablation approaches. See on-screen citations for study details. Potential risks include vascular access complications, cardiac perforation, thromboembolic events, and arrhythmia recurrence. Risk mitigation includes careful catheter positioning, adherence to prescribed energy delivery parameters, and compliance with all instructions for use and procedural guidelines. By addressing the limitations of thermal ablation, the FARAPULSE pulsed field ablation system enables precise, tissue-selective pulmonary vein isolation with controlled energy delivery. This approach supports procedural efficiency and consistent lesion formation within appropriately selected atrial fibrillation patients. Refer to the instructions for use and published clinical evidence for full indications and outcomes.